World Mental Health Day as a celebration, we are organized this intruding session on depression and suicide prevention in collaboration with Rotary Club of Pistil, Rotary Club of Parvat Pokhara, Rotary Club of Pokhara University, Rotary Club of Pokhara, Gandaki Medical College, United for Impact, and Noor, a journey towards mental health. We have organized the session with the distinguished guest whose contribution has been remarkable in the field of mental health. Without any further delay, I would like to formally start the session welcoming our guest speaker, Manu Shah. She is the founder of Noor, a journey towards mental health. She is a US State Department alumni under the CE program, fellowship program. She has a bachelor's in psychology and a master's in health policy and management with more than 3 years of experience working in mental health promotion and awareness. It has been her absolute mission to spread vital awareness about mental health within her community and around. Without any further delay, let's welcome her and hear from her. The floor is yours, Manusa.
Thank you so much. Can everyone hear me? Okay.
Yes, you are
Thank you.
audible.
Thank you. So thank you so much, Arti, for introducing me. So okay, I'm gonna start. Okay, so thank you for so much for introducing me. I had like a small introduction about myself, but I guess I'm gonna skip that. And also one more thing, I'm also from Pakistan, and thank you for the Rotary Club for having me today to be with you all and talk to you about depression and suicide prevention on the occasion of World Mental Health Day. So the objectives of the workshop are basically we have only one simple objective, which is to initiate conversations on depression and suicide prevention, reduce stigma, and provide participants with the knowledge and skills to support individuals who may be experiencing mental health challenges. So our workshop overall is going to be like, as the objective states, is going to be like really focused on what depression is, what suicide is, and how like stigma, like what is like the stigma surrounding it, how we can reduce the stigma, and how we can play a part in preventing depression and suicide in the community by reducing the stigma, and then I'll be also talking about some coping strategies, like that some strategies you can use to work on your symptoms and related to depression and suicide. Okay, so I always start off with a little icebreaker. So I noticed that almost everyone has their cameras off. So if everyone could turn on their cameras, so I can see everyone, and if everyone could go to this QR code, scan the QR code, and describe how they're feeling today, so we can start off with me knowing how everyone is feeling, so then we can keep the pace up like that. So I'm gonna also be sharing the code and everything for the Mentimeter on the chat as well. So if someone is not able to scan the QR, they can go to the Mentimeter through the link. All right. Okay, responses are coming in. People are feeling motivated, sick, better, good, excited. Okay, I'm gonna wait for a few more minutes until people start sending in there, and then we can show everyone's moods, so everyone is very aware of how they're feeling. Everyone is feeling, and still don't see. Excited. Right. So I'm certainly very excited to be here and to be talking about one of my favorite topics. So I guess if everyone has sent in their moods for today, let's move on. So everyone's almost feel like the most common answers are excited, sick, motivated, good, peace. So these are, I think, good feelings to have today for this session, and I hope what is next to come is like very informational for you guys. So let's begin. So let's talk about depression. So what is depression? Oh, sorry, I got a call in between. Okay. So let's talk about depression. What is depression? So depression, as you guys can see over here, it's a very common and a very serious mental health condition that can be characterized by persistent feelings of sadness, hopelessness, and the loss of interest or pleasure in activities. So I'm pretty sure everyone has in their time in their life heard or used the word or term depression, like I feel depressed, this is so depressing. So this is like a common word that everyone uses, and I can say this with certainty because before I went on this journey to become like a mental health professional and had like a degree in psychology, it was also a term that I used very frequently. Oh my god, I feel so depressed, and people around me use this term very, and we still do, because depression is usually like people just associating them like with sadness, but depression is just more than sadness. It is a feeling of sadness, yes, but it is also hopelessness, loss of interest, and pleasure in activities. So depression is, or major depressive disorder is, um, proper mental health issue that is characterized in the Diagnosis and Statistical Manual, which is given by the American Psychological Association. So it has like some symptoms that a person needs to have for at least 6 months in their life, and they need to be persistent, and they need to be there. So this is a whole list of 9 symptoms that you guys can see over here. So out of these 9 symptoms, a person needs to have at least 6 for 6 months, and they need to be like constant. Like they can't be like 6 months only, like you only have it like for 3 months and then you have it, like you don't have it for 3 months and then you have it for 3 months again. You need to have it continuously for 6 months. They should not be like gone within that time period, but like 6 whole consecutive months. So depression, the symptoms are depressed mood for most of the day or nearly every day. The mood should be mood should be very low of the person. They should, they always feel down and not up to anything. So that's like the depressed mood for most of the day, and then loss of interest or pleasure in almost all activities, things that you like doing or they like doing, they don't feel like doing that anymore. For example, if a person liked to read and was reading constantly, read a book almost every day, and now you suddenly see they're not reading, or if you see they used to watch television and now they're not watching television because they don't feel like it, not because their favorite TV show is not on air anymore, but just because they don't feel like it. Or if they used to play a game or used to go do some sports and now they're not into that activity anymore, it could be a sign of depression. Again, significant weight loss or weight gain is also a sign of depression. So this the weight gain or weight loss aspect varies person to person. So a person might significantly gain weight or lose weight. It really depends on the person's metabolism and how their body works. So it depends on that. And then insomnia or hyposomnia, lack of sleep or excessive sleep, again depends person to person and the physiology of the person. So this is like if you notice someone is now sleeping all day or is not getting enough sleep, this could also be a sign of depression. And then psychomotor agitation or retardation, where you can observe people getting like really fidgety for no reason, and they're just pacing the room often without like any purpose. This could also be a sign of depression. And then we can also talk about fatigue or loss of energy. They don't feel like doing anything. They get tired by just walking from one room to another. And the other physical reasons, like physical illnesses, could also be that reason. But if they're perfectly healthy physically and they're still facing loss of energy or fatigue, it could be a reason for depression, a symptom of depression. And then the feeling of worthlessness and excessive guilt. This can be characterized by where they actively say that they don't feel worthy of anything, and then they have these actions that show that these are, they don't feel worthy of something. Like if something good happens to them, they downplay, like, oh, I don't deserve this. This is not something that should be happening to me, but happening to someone else. Or if something happens around them, they feel really guilty about it, even though it is not their fault. And then difficulty concentrating or making decisions, concentration. So, does anyone here know what's like the average time a person can concentrate for, like a adult? How, like, what's the average time of concentration? Then I can talk about what's the how can the concentration level decrease. 45 minutes, yes. 45 minutes, technically speaking, an adult should be able to focus and concentrate on something for 45 minutes. But unfortunately, with the advancement of technology and social media, new researches have come up that now people can only pay attention for or concentrate for hardly like 4 or 5 minutes. We have gone down. This is like something a small kid can. Then our concentration levels have gone down to a small kids, but exactly difficult. So 45 minutes. So we are judging from the 45-minute criteria that you heard me. So from 45 minutes concentration, your concentration is like 5 or 5 minutes or 5 or even less than that. So if you can't concentrate on anything that made you like that you were interested in, and now you have difficulty concentration, that depression could be a reason. And even making decisions could be a very big concern for people who have depression, because because they're always feeling worthless or guilty and they're like agitated. So making decisions for them would also be like very difficult. And then obviously there are like, this is like the most severe symptom. Once this symptom starts coming in, it means the depression of that person is on like the highest level possible or the most severe level, which is recurrent thoughts of death, suicidal ideation, or a suicidal. So that's like what in psychological terms we consider like the severe part of depression, where like technically first okay. So this is like where we say that this person is now at like the end of their depression, not in a good way, but like this is like the last stage of depression that we consider. Okay, so I have few myths and facts over here. Now we talked about what is depression, the symptoms of depression. So over here I have these 5 points, and now I would like to interact with the audience. So if we could go by one, where we can talk about if the first point is a myth or not. Like, so before we go on to the myth versus fact, and we determine what is a myth here and what is a fact here. Are there any questions related to the first few slides that I shared, like about depression itself? Does anyone want to share anything, or anyone has questions regarding the symptoms? Anyone? No questions? Right. Okay, so we are going to be moving forward with the myth versus fact. Over here, I need everyone's participation, where we're going to be discussing what is a myth and what is not a myth. Alright, it's pretty much clear. Is it possible? Okay, we have. Is it possible to record the session for those who could not join?
We are trying to record it, so we are not sure if the audio and all will be pretty good, but if everything works out fine, we will surely provide you the recording. And also I wanted to add that as our mentor is constantly speaking, if it's possible, if you could turn on your videos, then it would also be engaging for her, so that she won't feel that she's talking alone. And sorry for my voice, I'm a bit sick. Thank you.
Thank you. Yes, I would really like it if I could see everyone who I'm engaging with, and then we can also. And it'd be nice to see everyone's faces. Okay. So depression. Okay. Now myths versus fact. So the first statement. Let's talk about the first statement. So depression is only in one's head. So what do you think? Is it a myth or is it a fact? And why? I would like to know the why. So if someone from the audience can volunteer. Okay, we have Asim who here said it's a myth. So Asim, can you please elaborate why do you think it's a myth? You can turn on your speaker. You don't have to particularly write in the chat. You can also say it out loud. Right. So yes, this is certainly a myth that depression is only in one's head, because even though like it is a mental health illness, a mental illness, and it has like psychological roots which are really in the brain, but depression comes in the form of physical as well. So symptoms can be physical, they can be emotional. So it's like a whole thing. It's not just in your head. Depression affects your whole body, your whole personality. So depression is not only in one's head. Yes, depression can cause stomach pain, body pains, aches, headaches, crying. It can have so many symptoms. The symptoms that I showed you guys initially, these are like the main symptoms of like at least American Psychological Association looks for. And suffocation, yes, exactly. It's like so many more things just than something being in your head. And one interesting fact, there is a study conducted by Johns Hopkins in Africa and the US, and in the African population, they saw that the African population had more physical symptoms as compared to psychological symptoms for depression as compared to people in the US. So this was like a very interesting study that they did about how depression varies from ethnicity to ethnicity, so or person to person. So yes, it is very much physical as well, and you can have physical symptoms. You can have pain in your stomach or any point that captures stress or sadness more. So yes, it is not just in your head. It's physical. It's like a amalgamation of everything in your body. And then let's move on to the second statement, which is depression isn't only brought on by a traumatic event. What do you think? How is depression brought on? Is it only brought on by a traumatic event, if someone goes through something traumatic in their life, or it can happen just to anyone? Is that a myth or is that a fact? I'm still waiting for answers. Okay, we have around 40 people. Yes, it's certainly a fact. Okay. Yes, the second statement is a fact. You don't need to experience a traumatic event in your life to have depression, but a traumatic event can cause depression, but it's not necessary. Yes, it can be a reason for depression, certainly. So it's not only something that is brought on by a traumatic event, it can happen to anyone. Depression can also be genetic. So apparently, if you have someone in your family who has had depression, there's a 50% chance that you might have it too. I know that's like, but then there are a lot of environmental factors that depend on you having depression or not. But then there is a 50% chance that it can also be genetic. So it could be something brought on from the environment, it could be genetics, and it does not only have to be something very traumatic in your life for you to have depression. Okay, we have some answers here. It can develop after trauma. Trauma can be a reason for depression. Like as we discussed, it can be a reason, but it's not the only reason for depression. Fact, because it can cause due to helplessness and hopelessness. Yes, because there are a lot of reasons why you can face depression, and it usually people, especially in like low and middle income countries, people have depression because most related to financial issues, relationship issues, and all of these different issues, and those certainly do not have to be traumatic. And then like we said, 50% chance that it's genetic for you as well. And then let's move on to the third part where it says medication is the only management option for depression. What do you think? Is medication the only way you can manage depression within yourself? Myth. Myth. Okay. Yes, that's correct. It is certainly a myth. Medication is not the only way. In fact, psychologists and even psychiatrists these days, they tell you medication is like the last option, the last resort for depression. But counseling and changing your environment and making your environment a better place can also be very good for managing depression. So medication is always the last resort, but talk therapy, counseling, going to a psychologist, talking to someone, or like initially just talking to a good friend of yours who listens to you without judgment can be a good way to manage your depression. And then obviously there are some coping strategies like art, meditation you can use to manage depression as well. So medication is not the only way. And we have a contribution from Roshni. So not only medication, psychosocial counseling, environmental changes can also help lessen depressive symptoms. That is correct. That's just what we discussed. So all of these things can help in managing your depression, and medication is not the only way. In fact, it's the last resort that one should go to when they want to manage depression. And let's move on to the fourth statement that says depression doesn't look and feel the same for everyone. We discussed this already when we were discussing symptoms. So what do you guys think? Depression doesn't look and feel the same for everyone. Is it a myth or is it a fact? Yes, certainly it's a fact or a myth. Okay, we have someone who said it's a myth. It doesn't look the same for everyone. Fact. Right. Okay, we have more answers coming in. So yes, it is a fact. Depression doesn't look and feel the same for everyone. We discussed this earlier. Some people can experience weight gain, some people can experience weight loss, some people may experience insomnia, some people may experience hypersomnia, and then they may also like we talked about the study from John Hopkins that said the African population had more psychosomatic symptoms as compared to the US population who had more psychological symptoms. So it wasn't certainly the same for everyone. And then out of the 9 symptoms I showed you guys, you can face a combination of any 6 symptoms within a person for 6 months for them to be characterized as depressed. So 9 out of 6 symptoms. So the combination can be like anything, right? So yes, so it is different for everyone. It doesn't look the same for anyone. You can be identical twins and you can still have different symptoms. Like depression can look different on some people can be very happy during that time during the depression, and some people can be visibly depressed. So we have some more things coming on in the chat. Fact, because some depressive patient may have sad expression, but still depression. Yes, this is Roshni. Certainly, I feel like we are like both certainly on the same page. There, like when you talk about how can a depressed person be happy, right? So I can give you guys a few examples on this. Like there are a few famous celebrities who died of depression or suicide, and they were depressed. But then when you look at them before they died, you could never tell that they faced depression. And some of those very famous celebrities include like we had the Linkin Park main lead singer, and few cases in Nepal too. Okay, we'll be talking about. I do want to talk more about that. So there was this very famous singer in Linkin Park. I forgot his name, and then we had Robin Williams. Yes, thank you, Mega, for pointing that out. I was trying to remember Robin Williams' name. Robin Williams, he was, and the Linkin Park singer. Their symptoms weren't very depressive. Yes, Chester Bennington. Sorry, thank you for telling me the names. I could not remember the names. So these are like examples of people who came out as cheerful and happy to the world, but deep inside they were going through depression, and as a result they ended their lives. So these are like a few cases where people can appear happy, cheerful, everything's going good for them, but they could be going through depression, and hence it doesn't look and feel the same for everyone. And then depression is a part of normal life. What do you guys think? Is depression a part of normal life? Myth, fact? This is like the 5th point. Depression is a part of normal life. What do you guys think about it? Is it a myth? Is it a fact? Is depression a part of normal life? Yes, no? We have answers coming in. So it's certainly a myth, because depression, like we said, it's a mental illness, and as the definitions of mental health or health in particular state, that it is the state of being not only physically or mentally ill, but also well, you need to be well in order to be that, because it is regarded as a global burden disease. Yes, so being depressed or having depression is not normal. You can feel depressed at some point in your life, you can feel sad at some point in your life, but you cannot be in depression throughout your life, because that's not normal. You need to be mentally well, mental well-being, well-being we talk about, to be at your optimum. When you're at your optimum, you are not depressed. Depression should not be a part of your normal life. So we have some, yes, like Roshni said, a global burden of disease is and it's one of, so A fun fact: depression. So a century ago, uh, communicable diseases, they were something that were part of the global burden disease, and they were the major killers, or major killer diseases in the world. And every person, like the stats stated that communicable diseases are like the major killers for people in the world. Now they're non-communicable diseases, and in non-communicable diseases, the top out of the top 5 non-communicable diseases that kill the most people, depression is also rising. Surprise, like not surprisingly, on the top 5. It's almost like on the top, and it's fifth now. So depression is not a part of a normal life, and it's one of the major killers in the world these days. So it is not a part of normal life. And if someone says depression, oh, it's normal to have depression, you need to correct them that it's a serious mental health issue that needs to be addressed, and it is certainly not a part of life. And then someone else has written, it is different from mood swings and feelings about everyday life. Yes, certainly it is very different. People can have mood swings, girls can have mood swings because of their menstruations, boys can have mood swings because they're boys, or other reasons. But they're very different from having mood swings or being sad about something or grieving about someone or something. So it's not a part of my life. So now let's move on from the just depression, and let's start talking about suicide and suicidal ideation. But before we do move on, anyone has any questions or any myth or fact that they want to talk about, or clear out any confusions regarding the facts or about depression that we just discussed? Someone raised their hand.
Yeah, I think Sabine.
Yes.
Yes, Sabine, go on.
If you could, if you want to write your question down, that would be fine as well. But if you want to say it out loud, that's... Do we have a question, or should I move on? Depression can change how we think, myth or fact. Okay, we have a question from Ujjal. Sorry if I'm not pronouncing your name right. Yes, it can certainly change the way you think, because like we mentioned, you can feel agitated, you can feel anxious, you can, you have excessive guilt. So that certainly changes your way of thinking. But it's like your thinking becomes more negative when you're depressed as compared to when you are mentally well, or you know not depressed. So yes, you become more negative, you feel more guilt, you don't like everything around you. So it can change the way you think. And then like we said, it's not only like psychological, but it's like also physiological. And the chemicals in your brain, they start rewiring your brain. Your brain literally gets rewired when you're depressed. So certainly your thought flow and processes also change during depression. So it can change the way how we think and perceive things as well. So yes, so it's definitely a fact that depression can change the way how a person sees the world, thinks about certain things. So any more questions, or should we move on to the next? All right, so I'm going to move on with the interest of time. So now that we talked about depression, and then in one of the symptoms was suicide or suicidal ideation or talking about death. So, but what exactly is suicide? So now, before I actually go into this, it's a very sensitive topic. I understand, and if you feel the need to step away or step out, please do so. Your mental health, your own well-being is more important than learning about what suicide is. So, if anyone is feeling overwhelmed by the topic, they may step out, or if they have questions in between, if they want to share something about this particular topic to let it out, you're most welcome to do so. So, what is suicide? Before we get into like the definitions of suicide and everything, I was doing some basic research about the Nepali context about suicide and what are the statistics there. So fortunately or unfortunately, I think Pakistan and Nepal has very similar things going on when it comes to mental health and suicide prevention. So we both are not, like, both the countries, they're not doing as much as they should be doing. So what I came across recently was that apparently there are around, last year there were around 700 deaths by suicide in Nepal, which is almost a similar number to that of in Pakistan. So the rate of suicide is alarmingly high in both the countries. And then, so I would like to acknowledge that. So if you know anyone who has experienced suicidal ideation or has committed suicide, or if you are going through the ideation yourself, I'm here for you, and all this community that you guys have gathered is also here for you. Okay, so what is suicide? Suicide is the act of intentionally taking one's own life. It is a complex and tragic outcome of various factors, including mental health issues, emotional distress, social isolation, and life circumstances. So, depression is one of the main reasons why someone might die from suicide. But then, depression is not the only mental health issue or an issue, particularly, that why people might die from suicide. It could be financial issues, it could be relationship issues, any sort of emotional distress, educational issues, social isolation, and different life circumstances. And other mental health issues that result in suicide usually include eating disorders or bipolar or schizophrenia. These are other major mental illnesses that are, preceded by suicide. Okay, so how to identify if someone has suicidal ideation? There are so many signs, so many signs. One could be verbal signs, where a person is actively talking about dying, committing suicide, ways on how they can kill themselves. So it's like one way you can identify if someone is actively talking about dying. It is concerning. So always be like, if someone does talk to you about, oh, this is how, if this happens, I can die like this. If this happens, I can die like this. If someone's talking like that, take it seriously and approach that person with care and try to talk to them if whether they are actually suicidal ideation, if they're actually going through suicidal ideation. And then there are behavioral signs, behaviors such as organizing their stuff or giving away their stuff, and making sure things are in order, and arranging or planning their funeral or anything of that sort, that shows like they have changed, or now they have started acting more nicely towards their family or friends, or have started withdrawing from everyone. Like, withdrawal is like a major symptom of depression as well from the people around you. So if they have started withdrawing and now their behavior with themselves, with people around them, with their stuff has changed, it is also a huge sign that they might be experiencing suicidal ideation. Mood changes, they could become like very happy all of a sudden. They could be, you know, meeting people with more enthusiasm than they initially ever did. Or they could be like completely withdrawn and they're like, oh, I don't want to talk to anyone anymore. So this could be another factor. And then social factors can include financial issues. Maybe they just lost their job, or maybe they lost someone close to them, or they lost their house, or anything within the environment that has suddenly changed. And now, as a result, all these mood changes or behavioral changes or verbal signs have started coming up. So these are something that you need to be on the lookout. And planning, like we said, verbal signs, they could be talking about, this is like how I can die, this is how one can die, but they're actually planning things. They're planning on getting their things in order. They're writing a will, even though like they're perfectly healthy. They could be like, giving away their stuff. They could be like, you can take this when I am dead. You can do this, and all of those things that come under planning could be from giving away their stuff to planning on how they can, kill themselves is one major factor. And then saying goodbye. Like they come to meet you and they call you and they talk about, okay, I just wanted to say, wanted to talk to you, and I wanted to know if there are no hard feelings between you and me, or would they want to apologize for something out of the blue that you don't even remember about. There was no major significant fight. So this could be a way of them telling you indirectly by saying goodbye or apologizing or doing these, like, interacting with you in a way where you might feel weird, like, okay, what is up with this person? So these are some ways to identify suicidalization. So these are like some very common identifications for suicide and within a person, like suicidalization in a person. Does anyone else wants to share what other things might come under suicidalization? Anyone wants to share about suicidal ideation that they have seen within their community or anywhere around? All right. So I guess we're gonna move on. So again, we're gonna do some myth versus fact for suicide. So let's get back to our keyboards or open our mics for this one. So someone who has their act together is not at risk for suicide. What do you think? Is it a myth or is it a fact that someone who has all the acts together in life is perfect for them, and is that person at risk for suicide or not? Myth or fact? Myth. Okay, we have some answers coming in. All right. It is certainly a myth that even if people have their lives together, they can be at risk for suicide because visibly everything seems maybe fine, but they might be depressed. They might be facing financial issues. There could be so many things. So yes, it's certainly a myth. We have a comment that says they may only be showing that they are okay. Yes, that is certainly true. They might be only showing everything okay. And then again, we have the examples of Robin Williams and Chester, who showed the world everything was fine, but then in the end, we all found out they died by suicide. So yes, people who have their act together, certainly may be at risk for suicide, and certainly overthinking may also lead to depression. Yes, overthinking can lead to depression, but overthinking is also a symptom of depression. So it really depends on the way you're looking at. So yeah, it can lead to depression, but overthinking is usually a more prominent symptom of anxiety than and making you more anxious and giving you anxiety more as compared to depression. So you may be more anxious, or you may have more anxiety, or you face general anxiety disorders as compared to depression. But it is like not directly, it may not directly lead you to depression, but it may take you through a whole roller coaster of anxiety. And then can you clarify some difference between anxiety and depression? So anxiety and depression, okay, so they're like very, like I can just go through it like really briefly because we have to do move on. But so anxiety is where anxiety has a lot of physical symptoms as well. So it's overthinking, it's constantly thinking about one person. One person, like thinking about, okay, we have another question. Okay, we have a lot of questions on anxiety. Okay, so the difference between anxiety and depression is that in anxiety you do not have like a persistent feeling of sadness or guilt, but in anxiety you constantly worry about things like, okay, how will this happen? Like the questions about how will be like, how will this happen? You're like constantly thinking about a certain task and how to reach that task. And then anxiety can be about particular things as well. You can be anxious about your studies, you can be anxious about your life, how you can get there. And anxiety is really very numbing. When you get really anxious, it it usually stops you from doing things actively. So if we talk very like biologically about it, it can be like your parasympathetic system and your sympathetic system. So depression is like where your your sympathetic system sort of kicks in and you like freeze. You don't like, no, you very, and your sorry, I'm messing this up. So basically in anxiety you can either freeze up or you can really take action. So anxiety can be good and bad, and it depends on like why you're anxious. It definitely has like overthinking involved in it, and you like your heart is racing, your palms are sweaty. So this is like all symptoms of anxiety. But then depression usually like shut down and symptoms, and you are more emotional when it comes to depression as compared to anxiety. And what can a person do when they are anxious? Focus on breathing. Breathing exercises certainly help, but then breathing exercises also help for depression. And then you can also, for anxiety, it's always good to have to-do lists. That's personally what really helps me. Make your to-do list, like what you need to do throughout the day for you to cope with your anxiety. And then obviously there are different, depends on what you're anxious about. There are different ways a psychologist can work with you to overcome your anxiety. So I think let's move on from this topic. We can certainly talk about more about this later on if we have time. So okay, we're on notice in a second. So many people who have attempted or completed suicide have not had a mental health issue. So what do you think? Is a myth or a fact that people who attempted or completed suicide may or may not have experienced a mental health issue? Myth, fact, that suicide can be only completed or attempted by someone with a mental health issue. Yes, so we have a question coming up, like answers coming in, and we have only one answer that has come in, which is true. So yes, it's true because people who do not have depression or any other mental health issue may also commit suicide. Yes. In fact, because we have Roshni that has written because people might commit suicide due to situational crisis. Yes, that's true. Like we talked about financial issues, relationship issues, social factors may also contribute to someone committing suicide. So just having depression or a mental health issue is not why people commit or complete suicide. So moving on to the next part, or the third statement, talking about suicide increases the risk a person will complete suicide. What do you think? If you talk more about suicide, there's more chances the person will be completing their suicide or dying from suicide. Yeah, okay. We have answers coming in. I mean, I'm really happy to be seeing all these answers and all this participation. Yes, it is certainly a myth, and thank you, Rashni, for pointing it out. That myth because it will be more help to be aware. Yes, because the more we talk about suicide, the more in our community around us, to people who might be facing suicidal ideation, the more they will open up to talking to you about what they're going through, and they will be more aware, and then they might also actively start seeking help for that particular issue. So yes, it's a myth that talking more about it will increase chances of suicide, like even completing suicide. It's completely a myth. Talk about it, get out there, talk to someone you might think is feeling suicidal, that are you feeling suicidal, go out, reach to them, so they might actually open up to you and then also seek appropriate help. And then moving on to the fourth statement, people who talk about suicide are just seeking attention. Myth, fact. Certainly a myth. Myth. Yes. It's certainly a myth that people who talk about suicide are seeking attention. I mean, they might be seeking attention because they might be trying to tell you that, hello, I don't feel good. I want to leave this world. But then they are generally trying to express their feelings. It's not about just seeking attention. It's about talking about it, and it is a symptom of depression. So they're not just seeking attention. They want genuine. They're genuinely concerned. They genuinely feel this. So it's not about seeking attention. It's something that they're actually feeling. So yes. Okay, we have something from Roshni. Myth because mostly people are at their traumatic condition while committing suicide. Yes, it's certainly a myth, and they could be, they could not even be talking about it and or seeking attention. They could be like doing completely withdrawn. It totally depends, right? But but someone who talks about suicide does not mean they're like seeking attention. That means they genuinely need help. And then the fifth statement is there are almost always warning signs if someone is suicidal. So, myth, fact, that there are always warning signs. Okay, we have answers coming in. Okay, so everyone here has said it's a myth that there are always warning signs, but this is a fact. There are always signs. We might not be able to tell, but there are signs. And the question is really how, if we can't tell how there are signs. Just because we can't see something does not mean it's not there, right? So they could be having a mental health issue. We talked about it, right? So I can give you an example of Chester Bennington, the Linkin Park singer. So I really, when the news broke out, I really dived deep into like his life to because people are talking about, oh, there were no signs, there were no symptoms, what happened. So I like really dived deep into that and during that time. So there were signs. The first of all was that his friends and family, they talked about like how they were hanging out more as compared to they initially did as compared to initially. So that's a sign they were hanging out more. He was hanging out with his family more. He was more involved in the house, etc., etc. And then his songs, the song that Linkin Park is so famous for. If you listen to those songs, like with like a psychological lens or the ear of a psychologist, you can be like, oh my god, like those are all signs. His art, his music, his life was an entire sign itself. And then Robin Williams, in one of his interviews before he died, he talks about how he wants to make the entire world happy, and how he wants to see everyone happy, and etc., etc. That was a sign because he knew what it felt like to be sad. So that was a sign. So there are signs. The signs may not be so obvious, but there will be signs. There will be signs in terms of their work, their environment, the way they have started behaving with people. Like we talked about behavioral changes. So there will always be signs, but it just how we look at those things is something that we need to work on. So there will always be signs. They may be very hidden in their work, in their everyday lives, but there will be signs, and just need to keep like a very open eye. So this is not a myth, this is a fact. Okay, now we have talked about myths and facts. So let's talk about some stigmas. So we talked about myths and facts and what depression is, what suicide is. And I personally believe, and research also indicates that when we challenge stigma related to anything in our lives, we are on our way to preventing it when we challenge something. So I have four statements given here, and I want at least some of you to tell me how you would challenge these stigmatizing languages in your own community when someone talks about depression or suicide. Because when we challenge something in front of anyone, person who might be feeling depressed or going through depression or suicide ideation, they will know they have an ally. So how will you challenge one of these four statements? And I would like to hear the strategy instead of maybe you writing it down for better understanding. I'll be just taking like 2 to 3 strategies if possible. Then we can move on to concluding our session. I'll give you guys a minute to think about it, then we can start. Or we anything, like there are no right or wrong answers. I just want your perspective on how you would challenge one of these four statements. Or if you have any other example from your own community that you think you challenged, like a language that you challenged about suicide or depression, you can talk about that as well. Anyone?
पानी ल्याऊ, पानी ल्याऊ, यो क्यामेरामा नआऊ है, ल्याऊ। ल्याऊ।
We have no one who wants to give it a go. Like I said, there are no right or wrong answers. This is not a test. This is just your way of addressing people who might be using these words for you to act as an ally for depression and suicide prevention. Anyone? No? Alright, so I guess within the interest of time, Rohit, how much time do we have left?
We have few more minutes, maybe 15 minutes or
Alright.
10 minutes, yeah.
Alright. I guess. Okay. So, anyone? Okay, I guess no one can think of some strategies, or they're too shy to share their strategies for challenging stigmatizing language. But guys, always know that when you challenge something, especially when it comes to mental health, because it is a stigmatized topic in our countries, it's important that we always talk about it and we always correct someone when they might be using problematic or stigmatizing language, like, oh, she was so selfish for committing suicide, snap out of it, just think positive. Depression is just a phase. You correct them on these things, because when you correct people who are stigmatizing the already stigmatized issue, it's when you tell people who are actually facing these issues, who are going through depression or suicidalization, that you are an ally. And when they know that you are an ally, they will be more open to talk to you about it. They will be more open to talking to you about it and sharing their concerns and their feelings. And then maybe they will reach out to you on how to get better, how they can reach out to a professional, what they can do. They will know that there is someone who is there for them, instead of just thinking that they are acting or they are seeking attention. So, okay, we have a response that came in. Yes, so that is true. Sujal has wrote that this person committed suicide is stigmatizing language, and this person died by suicide is a respectful language. Yes, it's always important that you respect that, because suicide is a symptom or like an act of mental illness, and you die by suicide. You need to be very respectful of how you address this, because committed, it means like committed a sin or a crime. That's how we usually associate that word or describe something, right? So you need to be like, they didn't do it themselves, they died from it, because it was something that they were experiencing. They were going through suicidal ideation, so they didn't commit suicide, they died by suicide. So that's like how we should be ideally describing someone or talking about someone who died by suicide, right? So that's. And then if someone says depression is just a phase, it will pass, it's a mood swing, you need to educate them that it's a persistent feeling of hopelessness, guilt, feeling agitated, and all those symptoms that we discussed for 6 months. It's not a phase. A phase is like a month max. 6 months is like a good part of your life. So it's not a phase, and it's a serious illness. We need to educate people about it, that it's a serious illness. It's not just a mood swing. It's not just a phase. And then also correcting someone when they use the words crazy, nuts, or insane for people facing depression or any form of mental health illness, where you need to correct them that this is not how you use it. If someone uses depressed or crazy or schizophrenic or bipolar as like a joke, or to describe someone who might not be, facing all of these issues is also a very problematic behavior that needs to be corrected. And also because some people use all these words like as a form to describe people around them in their everyday lives, may also downplay the importance or the illness of someone who might actually be facing these serious mental health conditions. So let's move on if no one else is commenting on this. So how do we cope with this? So the most important part, like we talked about, was challenging the stigma. We can do it as a community level, we can do it within our friends and family. And when we talk about, when we challenge the stigma, we tell people we have an ally. They have an ally with us. Then it's always important to reach out to your friend or family members who might be feeling suicidal or might be feeling depressed. Or if you are feeling depressed or suicidal, you need to reach out to your dearest friend or family member who you can talk to. Or you reach out to someone you can talk to, or reach out to someone who, it goes both ways. If you're feeling depressed or suicidal, you need to reach out to a close friend or a family member, or if you know someone, you need to reach out to them. So this goes both ways. All of these goes both. Then you need to practice mindfulness. So mindfulness exercises, they have proven to be very effective when it comes to helping people deal with depression and suicidal ideation. Mindfulness is also very helpful for anxiety because it helps you ground yourself and bring back all your negative thought processes and make them like more aligned with what's happening around you as compared to your brain just going into overdrive. So practice mindfulness. There are a lot of resources available on the internet that you can reach out to for practicing mindfulness. And then indulge in art through coloring or painting your emotions. Art is also one of the other very useful ways where you can cope with these symptoms. It's something that you can easily do at home. Everyone has any art material available at home. They can use that to paint what they're feeling or just scribble or do something. So art is a very good way to just calm yourself or get away from those negative emotions. Start a gratitude journal. If you feel negative, feel guilt, worthlessness, if you feel like nothing in life makes sense and only dying is the only option, every day just write down 2 things you are grateful about. 2 grateful things in your life, and that will help you, you know, come back from those negative thoughts about dying and the world. So this is what you can do, and then you can always revisit your gratitude journal when you feel like really overwhelmed and you can't even remember what to be grateful for. That journal or that list will help you come back to, okay, this is what you're grateful for in life. Like the person, it could be your parents, it could be your girlfriend, boyfriend, friend, sister, anyone you are grateful for. And then when you see that person's name or that thing's name written down, it will help you handle or manage your negative emotions more. And then reach out to a professional. Reaching out to a professional is so important, especially if you are feeling suicide. So this is reach out to a professional. From my research in the Nepali context, you guys have the same amount of psychiatrists and psychologists available as we have in Pakistan. So, and which is less than the WHO recommended. So always make sure you guys have your psychologist or psychiatrist identified. And if not, something else that I came across was that there is a suicide prevention helpline by the Nepali government, if I'm not wrong. I read about it like yesterday when I was going through the context of Nepali context of depression and suicide prevention. So there is a helpline by WHO and the government in Nepal. So look that up and keep it safe for anyone who might need it. So there is a helpline that you guys can reach out to in your country. So with the interest of time, I need to end this. And we had just one more small meditation exercise that I wanted to do with you all, but with the interest of time, maybe you guys can look this up, or I can share the presentation with you all later through the Rotaract Club, and then you guys can go through that. So thank you so much, everyone, for participating, for listening to me go on and on about depression and suicide prevention. So this is it from my side. Any questions or?
Thank you, Manur. It definitely was an insightful session. Now we are almost at the end of the session. If any one of you have any queries, you can write on the chat box, or you can unmute yourself and ask one, which will be addressed by our guest speaker. Any one of you? Do we have queries?
Also, there is a okay, there is a question before that. There is a attendance form and feedback form, which is a single form in the chat box. So you can also drop your questions there, which we will try to reply you in your email. And there are a few questions in the chat box. Maybe Manur can respond it now.
Okay, so the first question. So no, depression and bipolar are not the same thing. So bipolar is like extreme moods. So bipolar is like, so in bipolar you also have depression, but then so 1 minute you can be like really depressed, and then one moment you can be like really active and up and running. So it's like depression can come into bipolar disorder, but it's not the same thing. In bipolar you are usually like very happy or very sad, very happy or very sad, like two extreme moods, but like never like in a normal way. And it can be going like, you can be going back and forth. One day you can be really happy, one day you can be like really sad, and by really happy I mean like jumping off the wall is happy, and then really sad. But this is like something that, when depression is different, it's like what you talked about. Depression is a part of bipolar disorder, but it's not the same thing. And then, is depression more common in introverts? No, depression is certainly not more common in introverts. It can happen to anyone. Extroverts can be equally depressed as compared to introverts. So it's not um, something that we can be like introverts are more depressed than extroverts. We can't really characterize it like that. Is depression? Sorry, I don't get what the question is. Does anxiety hit nerves? Is depression always due to dopamine decrease? No, I mean, dopamine decrease is a factor for depression, and if it doesn't happen like because of your own system, but because of environmental factors, your dopamine may decrease. It's just not because your dopamine is decreasing you have depression, but other factors may cause your dopamine to decrease, but dopamine decrease happens in depression. Does anxiety hit nerves? It is little nerves or nerves that they get in are definitely a part of your, when you get anxious, so your all of that is depression is in. So all of these factors, depression hit. Okay, I don't really get the question if does depression hit nerves, but it is something that your nerves get, affects your nerves, and you can get nervous. So anxiety and nervousness can be like a very factor. So someone has written depression is the inability to construct a future. Yes, certainly it is. It can be that, but it really depends on the severity of depression. Any more questions? Sorry guys, I just need to.
Okay, so we'll take more questions through the feedback form, so you all can drop your questions there, so Manur can respond it later. Before closing, uh, I would like to thank everyone um, who uh, committed your time and uh, were present here. I would also like to thank Manur for her valuable time. Um, and so, if Manur could stop sharing your screen. Okay, great. Um, just a minute. Um, is my screen visible? No, I guess. Mm, mm, mm. I'm sorry, I wanted to share something, but
Um, I'm sorry, guys, but I have to take my leave now. So thank you so much, everyone, for participating, and I hope it was a very insightful session for you all.
okay.
So thank you,
Sorry,
and
I wanted to share token of love, but we will mail it to you. Thank you so much. If you have any queries, we will connect you to Manur later again. And thank you so much, everyone, for your valuable time. Thank you,
thank
Manur.
you,
Thank you. Thank you so
thank
much.
you. Bye.
Thank you, everyone. Have a good night.